The other big news story all over the media in this past week or so was the report in the New England Journal about the Mediterranean diet lowering, heart disease.
Right.
We've known that's been a healthy diet. Victoria, can you elaborate a little bit on what is a Mediterranean diet and what the key
Sure.
components of it are?
Absolutely. So, Mediterranean diet is a diet that's rich in vegetables and fruits, rich in legumes, which are, beans and lentils, things like that. Actually includes red wine, and is low in meat, especially red meat. There's some poultry. There's fish in the Mediterranean diet as well. So the important thing about this is that it's actually a diet that has a substantial amount of fat, and we like the taste of fat. It's got good mouthfeel. It makes you feel satiated. That means that nuts and avocados and olive oil now have all been redeemed. They're good for us. And in this study, they actually had three groups. They had a control group that they said to eat the low-fat diet. They did the worst. Low-fat diet needs to go out the window. It is not a good diet. I was surprised they actually were able to get it through their institutional review board, human subjects. Then they had one group they supplemented with olive oil, and another group they supplemented with nuts. It was walnuts, hazelnuts, and almonds. And the group that got the extra olive oil, 4 tablespoons or more a day, the group that got the extra nuts, actually had 30 to 40% less stroke, less heart disease. And so this is wonderful news because it's a really pleasurable diet.
Well, that's a good segue to say if I were your house guest for a week,
Yes.
all right, what would the menu be like at Dr. Mays' house?
Well, that's a great question. So, if you were coming, then I would want to make really wonderful wild Alaskan salmon and grilled vegetables.
No, I'm actually very serious because a lot of people are going to watch these videos and they're thinking, okay, what would be a typical sort of diet during the week? What should I focus on?
Yes. Well, again, in the book I just wrote, Be Fruitful, I actually described a week's diet, each day a different a set of meals. And you do want to be paying attention to your omega-3 fatty acids, so you're going to get that in fish, you're going to get it in eggs that have been, where the chickens have been fed flaxseed or algae. You want to be sure you eat lots of vegetables. Vegetables are probably the healthiest thing we could be eating, but not potatoes. Most Americans, it's potatoes that they're eating as their vegetable. That's not so healthy. But the cruciferous vegetables, broccoli and kale and Brussels sprouts and cauliflower, including these every day in your diet, they reduce the risk of breast cancer because of the way they alter the metabolism of estrogen to safer forms. You want to be eating some whole grains. Whole grains is not flour. It's really brown rice, it could be millet, it could be quinoa, but where the whole grain is intact. You want to be including nuts. We know this from the study you just mentioned in the New England Journal of Medicine. They're very satisfying, they're delicious to eat, and so those are the kinds of foods you'd see a lot of at my house.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.